Hello everyone, now let us discuss regarding the muscles of the head that move the eyeballs and the upper eyelids. Now, muscles that move the eyeballs are called as extrinsic eye muscles. Extrinsic eye muscles because they originate outside the eyeballs, that is in the orbit, and insert on the outer surface of the sclera, which is nothing but the white of the eye. The extrinsic eye muscles are some of the fastest contracting and most precisely controlled skeletal muscles in the body. Extrinsic eye muscles are some of the fastest contracting and most precisely controlled skeletal muscles in the body. If you see, there are three pairs of extrinsic eye muscles that control the movement of the eyeball. Three pairs. The first one is superior and inferior recti. The next is lateral and medial recti, and finally superior and inferior oblique. And the four recti muscles that are superior, inferior, lateral and medial, they arise from a tendinous ring in the orbit and insert into the sclera of the eye. And as the names imply, the superior and inferior recti move the eyeballs superior and inferiorly. And the lateral and the medial recti, they move the eyeballs laterally and medially respectively. The actions of the oblique muscles cannot be deduced from their names. The superior oblique muscle originates posteriorly near the tendinous ring, then passes anteriorly superior to the medial rectus muscle and ends in a round tendon. The tendon extends through a pulley-like loop of fibrocartilaginous tissue called as trochlea on the anterior and medial part of the roof of the orbit. And finally, the tendon turns and inserts on the posterior lateral aspect of the eyeball. And coming to the function, accordingly, the superior oblique muscles move the eyeballs inferiorly and laterally. Superior oblique muscles move the eyeballs inferiorly and laterally. And the inferior oblique muscles, they originate on the maxilla at the anterior-medial aspect of floor of the orbit. It then passes posteriorly and laterally and inserts on the posterior lateral aspect of the eyeball. Because of this arrangement, the inferior oblique muscles move the eyeballs superiorly and laterally. Inferior oblique muscles move the eyeballs superiorly and laterally. And unlike the recti and oblique muscles, the levator palpebra superioris, this we have discussed in the previous session, the levator palpebra superioris does not move the eyeballs since its tendon passes the eyeball and inserts into upper eyelid. It rises the upper eyelids, that is, it opens the eyes. It is therefore an antagonist to orbicularis oculi, which closes the eyelid. So levator palpebra superioris, it opens the eyelids, whereas orbicularis oculi, they close the eyes. Here you can see the muscles of the eye. This is the superior rectus, which aids in upward movement. And this one is the superior oblique. This is superior rectus and this one is the superior oblique. It aids in downward and outward movement. And this is the medial rectus. It aids in inward movement. And this is the inferior rectus. It aids in downward movement. And this is the lateral rectus, which aids in the outward movement. And finally, inferior oblique, which aids in upward and outward movement. Superior oblique aids in downward and outward movement. Inferior oblique aids in upper and outward movement. As we have discussed earlier, the extrinsic muscles of the eyeball are among the fastest contracting and most precisely controlled skeletal muscles of the body. Here you can see this is the eyeball and this one is the cornea. And this muscle is the lateral rectus. And this is the inferior rectus. And this is the inferior oblique. And this one is the superior oblique. Here you can see, this one is the superior oblique. And if you see here, this is the superior rectus And this muscle, the thin muscle, is the levator palpebra superioris, which aids in opening the eyes. This one is the right lateral view of the right eyeball. And this one, this muscle is the inferior rectus. And this one is this inferior oblique. Here you can see this is the levator palpebra superioris. And above it is the superior oblique. And this muscle is the superior rectus muscle, and this one is the medial rectus, and this one is the lateral rectus, and this is the inferior rectus. Now let us discuss about each muscle, its origin, insertion, action and innervation. First one is superior rectus. Rectus means fascicles are parallel to the midline. Coming to the origin of superior rectus, the common tendinous ring origin occurs at common tendinous ring that is attached to orbit around the optic foramen. Insertion, it inserts at superior and central part of the eyeballs. Coming to the actions, the superior rectus moves the eyeballs superiorly, that is elevation, and medially, that is adduction, and rotates them medially. Innervation is done by oculomotor nerve, that is third nerve. The next is inferior rectus. It occurs, origin occurs at the same site, common tendinous ring attached to orbit and around the orbital optic foramen. Insertion, it inserts at inferior and central part of the eyeballs. Whereas superior rectus, it inserts at superior and central part. Inferior rectus inserts at inferior and central part of the eyeballs. Coming to the actions, it moves eyeballs inferiorly, that is depresses, and medially, that is adduction, and rotates them laterally. Previous muscle, superior rectus, rotates them medially, whereas inferior rectus rotates them laterally. Innervation is by oculomotor nerve only. The next is lateral rectus. Origin is at the common point, common tendinous ring attached to orbit around the optic foramen. Inserts on the lateral side of eyeballs. Lateral rectus inserts on the lateral side of the eyeballs, and it moves the eyeballs laterally, that is abduction. Innervated by abducens nerve, that is sixth nerve. Abducens nerve. Lateral rectus is innervated by abducens nerve. Remember this point. Whereas coming to medial rectus, origin is at the same point, common tendinous ring attached to orbit and around the optic foramen. It inserts on the medial side of the eyeballs. Lateral rectus inserts on the lateral side of the eyeballs. And it moves eyeballs medially, that is adduction. And it is innervated by oculomotor nerve, that is the third nerve. Coming to the next muscle, that is superior oblique. Oblique indicates the fascicles are diagonal to midline. Coming to its origin, it originates at sphenoid bone. Superior oblique muscle originates at sphenoid bone, superior and medial to common tendinous ring in the orbit. Coming to the insertion, it occurs at eyeball between the superior and lateral recti. Superior oblique inserts between superior and lateral recti, and the muscle inserts into superior and lateral surfaces of the eyeballs via the tendon that passes through trachea. Coming to the actions, it moves the eyeballs inferiorly. Remember, superior oblique moves the eyeballs inferiorly, that is it depresses, and laterally, that is it aids in adduction, and rotates them medially. And it is innervated by trochlear nerve, that is fourth nerve. The next, coming to inferior oblique, it origin occurs at maxilla in floor of the orbit. Superior oblique originates at sphenoid bone, whereas inferior oblique originates at maxilla in the floor of the orbit. Insertion between the inferior and lateral recti. Inferior oblique inserts between the inferior and lateral recti. It moves the eyeball superiorly. Inferior oblique moves eyeball superiorly, that is elevation, and laterally, that is adduction, and rotates them laterally. And it is innervated by oculomotor nerve. And finally, coming to levator palpebra superioris. Palpebra means we know that palpebra indicates eyelids. Coming to the origin, it originates at the roof of the orbit, that is lesser wing of the sphenoid bone, and inserts in the skin and tarsal plate of upper eyelids. Coming to the action, it elevates the upper eyelids, that is it opens the eyes, and it is innervated by oculomotor nerve. Here is a list of various movements that are achieved by the extrinsic eye muscles. Elevation, depression, adduction, abduction, adduction, medial rotation and lateral rotation. Now let us discuss a disorder, that is strabismus, related to the muscles of the eye. Strabismus is a condition in which two eyeballs are not properly aligned. Strabismus is a condition in which two eyeballs are not properly aligned. This can be hereditary or it can be due to birth injuries, poor attachments of the muscle, problems with the brain's control center and localized disease. It can be constant or intermittent. And in strabismus, each eye sends an image to a different area of the brain, and because the brain usually ignores the messages sent by one of the eyes, the ignored eye becomes weaker. Hence, lazy eye or amblyopia develops. And external strabismus results when a lesion in the oculomotor nerve causes the eyeball to move laterally when at rest and results in an inability to move the eyeball medially and inferiorly because of a lesion in the oculomotor nerve, that is the third nerve. Whereas a lesion in the abducens nerve results in internal strabismus. Remember this point. A lesion in the oculomotor nerve results in external strabismus, whereas a lesion in the abducens nerve results in the internal strabismus. That is a condition in which eyeball moves medially when at rest and cannot move laterally. In external strabismus, it moves laterally when at rest and cannot move medially or inferiorly. Whereas in internal strabismus, eyeballs move medially when at rest and cannot move laterally. And the treatment options for strabismus depend upon the specific type of problem and include surgery, visual therapy, that is retaining the brain's control center, and ortho-optics, that is eye muscle training to strengthen the eyes. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.